Hello and welcome to our January roundup of news across the industry, keeping you in touch with the world of health and safety. The HSE statistics for Great Britain 2021 have been published recently in a convenient summary chart. Agriculture, forestry and fishing, construction, accommodation, food services, wholesale and retail trade had significantly higher injury rates than other industries, while health and social work, public administration, defence and education had significantly higher ill health rates than other industries. Entrecon Limited in Doncaster has been fined over £170,000 and costs for safety breaches after a worker suffered head injuries after falling from a stepladder while cleaning a trailer that had just been manufactured. The stepladders were positioned on top of the trailer. As he climbed up onto the steps, they started to wobble, causing him to fall out of the trailer onto the floor. The HSE found that there were no ladder inspection regimes in place and the equipment being used was not in good working order. Equipment used to access work at height should be routinely inspected and checked to make sure it's in good condition and safe to use. A representative from the Ladder Association commented, "It's clear from this case that the ladder in question was not fit for use. This could have been avoided if the company had carried out the correct ladder inspections. Detailed recorded visual inspections should be carried out regularly by a competent person, and pre-use checks should be carried out by a competent user before using a ladder." The Highway Code revisions will come into effect on 29th of January 2022 and include a new hierarchy of road users, which implies automatic culpability for drivers in accidents with more vulnerable road users, for instance cyclists or pedestrians. Drivers of vehicles that can cause the greatest harm in the event of a collision bear the greatest responsibility to take care and reduce the danger to others. There are some 90 million volunteers in the UK. Do some of them work in your organisation? Well, the Health and Safety at Work Act applies to them if your organisation also has employees. A recent case highlights such responsibilities. A group of volunteers were cutting back vegetation along a riverbank at an angling club. A member of the party was hit on the head by a thick falling branch and later died. None of the volunteers had received formal health and safety instruction, they had not been properly trained for the maintenance work they were doing, and they were using inadequate equipment. The club had failed to carry out a risk assessment despite this being part of its own policy. Guidance from the Angling Trust had been ignored and a proper exclusion zone around the felling site had not been set up. Organisations who use volunteers have to ensure their safety in the same way as employees. Arguably, extra care should be taken as volunteers are less likely to be familiar with the working environment and therefore less aware of the risks. Interestingly, the HSE annual statistics include work-related COVID statistics. There are an estimated 93,000 workers suffering from COVID-19 who believe they may have been exposed to coronavirus at work, and a further 645,000 workers suffering from a work-related illness caused or made worse by the effects of the coronavirus. Of course, reliably identifying the source of exposure to COVID-19 is difficult, and it cannot be assumed that these workers would not have been suffering from other work-related illnesses. Here at Delibero, we continue to add learning modules to the training dashboard, the latest being the safe use of ladders. We're also delivering manual handling training by means of individual coaching sessions, so please watch out for these.